Hello, I'm Geletaw. I will present our research entitled Design Approach for Executable Clinical Pathway at the Point of Care in Limited Resource Setting to support the clinical decision process. Review of state of the art. The outline of our presentation will include introduction, problem statement, method, result, analysis, as well as conclusion. A decision support system clinical pathways, a tool for bridging evidence-based divide at point of care. It is also known as care pathway, care map, or sometimes we call it integrated clinical pathway, and mainly used to improve the performance of healthcare management system. Aims to deliver and outline optimal logical path or plan of care from assessment to treatment, and mainly help us to know the optimal route the patient will follow. And however, up to now, far little attention has been paid to a systematic review, research, and development of clinical pathway in low resource settings. The main focus was in data-intensive environment where there is no shortage of resources. In addition, the motivation of this study arose a desire to help frontline workers who primarily make decisions based on hard copy clinical guidelines, patient card, and point of care charts. In addition, in low resource setting, lack of infrastructure, data management, as well as decision supporting. The patient's card give minimum as well as insufficient information. Lack of referral feedback, which leads to unnecessary referral or delay in seeking care, and many decisions are out of reach in low resource setting. The objective of this state-of-the-art review or this study is to design an interactive as well as automated clinical pathway in low resource setting. We try to investigate potential methods, approach, and strategies. We also examine existing technical challenges as well as future clinical pathway orientation in the context of low resource setting. A systematic research is conducted in 2019, and for bundling and categorizing the relevant approaches in low resource setting, we examine PubMed as well as Web of Science database. A strict strategy was designed and implemented, and the studies were included based on eligibility assessment. To select eligible studies, we review the title, abstract, and the objective of individual studies. The number of citation thresholds were set based on publication year. Those articles published before 5 years, we expect a minimum of five citations, whereas less than 5 years, we expect a minimum of 1 citation. We also review 4 articles where it was not possible to decide about the individual studies based on the abstract review alone. And the inclusion criteria or studies were included if they demonstrated and reported the application of CP, if they were examined the impact of CP, including evidence-based practice, improving outcome, reducing cost or delay, improving communication and feedback, or a combination of these factors. If they examine factors that impact the practice of CP, particularly those article studies in low resource setting were included for our analysis. And the data extraction is performed using standard Excel database. And a number of data or parameters were extracted, including the type, author, publisher, number of citations. And also we try to capture the context and mechanism and intervention strategies of individual studies. In addition, we also extracted the characteristics of the study, including the setting, the platform, approach, and technique. And this finally, the outcome of the study and the possibility to adapt and reproduce in low resource setting were extracted. After the data extraction, we were built a Python-based data interactive tool for data analysis as well as visualization. Then we try to examine the CP design techniques, platform, as well as approaches. And also we summarize the characteristics of the studies, including the citation, publication year, intent, as well as outcome. The overall searching strategy process and the result is presented in the screen. Initially, we identified a total of 164 articles And after identifying, we screening the individual article based on their objective and based on their objective as well as the duplication article. A total of 75 studies were excluded. And once screening performed, then we perform eligibility assessment, and a total of 44 articles were excluded because they are not fitting with an individual review and because of the topic of interest for building clinical path. Finally, a total of 45 articles or studies were included. Each studies were published between 1992 and 2018, and 10 of them are published in Sahle, 7 were published in Demisew, 5 were in Springer, and 4 were published in ETRO. And among the included articles, more than 67% of the articles published have more than 10 citations, and more than 73 uh, articles were published after 2012. And based on their study intent, 27 studies were trying to address automated and accessible CP, or try to deliver automated or accessible CP for the point of care. Those studies not only try to uncover the evidence or visualize the plan, the plan of specific care, but also try to compare between different CP. And the rest of the studies are trying to explore the advantage of computerized CP, functional requirement and benefit of CP, and also try to automate and generate computerized clinical CP from clinical guideline. Try to focus on the challenge and practice of designing and automating clinical pathway, and including exploring the patient current state, intent, behavior, and outcome, and so on. When you see the CP design approach and the platform, there are summarized into categories. Those CP are classified in knowledge-based CP or data-driven CP. From the included article, 25 of them are were following knowledge-based, and the rest is following data-driven approaches. Among the knowledge-based approach, 10 were for using executed in paper-based, 9 were in standalone, and 6 were in web-based application. Among data-driven approach, 2 were standalone, 3 were on web-based, but the majority, around 75% of the studies, try to integrate with electronic health record system. When you see the trend of CP design with platform, knowledge-based system were executed or designed in the early 19th and continue to do so. Whereas in the around 2007 and 2018, data-driven approaches emerged. Basically, the majority of trying to integrate with electronic health record system. And there are different techniques applied while designing CP in a specific platform. For example, those studies try to integrate with electronic health record, try to apply different techniques, including visualization techniques, scoring system, neural net, k-means clustering, and rating-based algorithm. Those trying to execute CP in standalone applications, they try to integrate automated system, decision support, probabilistic and rule-based and hierarchical methods, including Markov chain algorithm. In the case of web CP, they try to integrate different techniques like automation, probabilistic, and rule-based algorithm. Overall, the studies were classified and analyzed into categories. In terms of approach, those majorly classified into knowledge-based and data-driven approach. And data-driven knowledge-based approach try to execute in the form of paper-based, IT-based, or clinical guideline-based, and we call it sometimes model-based. Whereas data-driven is executed in terms of ontology-based, probabilitics, or NL or machine learning-based. And each technique has its own pros and cons, and some of the challenges of are present. For instance, the paper based clinical pathway is very time consuming, resource intensive, as well as not adaptive. Whereas the IT-based or automation-based, it is difficult to computerize the whole life of the clinical pathway. In the case of clinical guideline-based, clinical guideline is often is very ambiguous, incomplete, as well as inconsistent. And also in the case of ontology-based CP summarization and presentation is lack universally accepted standards, as well as difficult to incorporate the characteristics of different hospital or healthcare. And the case of probabilistic CP, it is very complex. When the probability grows and the complexity of the CP will grow parallelly, and dealing with the complexity is very challenging. In the case of machine learning or artificial neural based clinical pathway, it is complex and it is handling variation analysis very challenging. And there are some questions as well as challenges to address with respective of challenge. When you are following paper-based clinical pathway, it is very important to deal with contextual and personalization of CP. And also in ITBS, it is difficult to identify the computerized interpretable clinical guideline and clinical pathway. In terms of clinical guideline based clinical pathway, it is important to deal with intersectoral clinical pathway as well as cycle pathway. While cycle pathway means where most of the CPs try to extract CP from clinical guideline, but in the other way, whether the extracted clinical pathway is validates the requirement of clinical guideline or not needs to be checked. As well as in the case of ontology-based P, following the visualization is very important. Whereas in the case of probability, the needs to handle the complexity of CP, and in the case of neural net or machine learning, it is important to deal with the minimum clinical data. Overall, in low resource setting, to summarize, it requires intelligent clinical wizard, dealing with minimum data, dealing with data readiness, dealing with data inconsistency, dealing with adaptable service, as well as low cost solution. In conclusion, we will try to include mixed method, cross-sectional session, cohort studies, pilot studies, RCT, and so on. We identify the trends and approach of executing clinical pathway. It highlights the benefits that gained through clinical pathway, and it summarizes important consideration for building applicable clinical pathway in low resources. Overall, data-driven clinical pathway not only resolve the challenge of improving clinical pathway in low existing knowledge, but also try to enable the practice, outcome, the cost, and the length of time it takes, as well as unnecessary referral. Thank you.